Hi everyone, my topic is gender as social structure, why transgender and non-binary youth are systematically excluded from healthcare system. A lot of data shows that there is a long waiting time, regional inequality, and restrictive clinical norm push young people towards unsafe alternatives when they are seeking for help for their gender assignment issues. And from the theoretical lens, or we can use the Reisman's theory, gender as a social structure, as our foundation. Gender operates simultaneously at three different levels. From the highest level is the institutional level, like the policy making, and not that um, effective. And interactional level, like the engagement between doctors and patients, are not so good, so that pushes young transgender people away. And the individual level, like the identity, since it's like a systematic assumption inside healthcare system, so young people are afraid to seek the official help. Instead, they seek help from like internet, the online social media, and they probably get the jobs in some illegal way and can't control those very well. And from the policy side, we can get some data. Over 30K people are waiting for their first appointment. Two-thirds of them are under 25 years old, and the average waiting time has already exceeded 5 years, basically like waiting forever. And this is the data from NHS, the official medical service for UK. And the access varies a lot by regions. It already look like a postcode lottery. And we move to the only graph in our poster. This graph is the UK Gender Clinic waiting list, and it shows that among all the age groups, 18 to 25 years old had composed over half of them, 53.8%. And this data like argues strongly about how many young people are waiting and being excluded from the official medical treatment regarding gender. So we can get the conclusion that healthcare exclusion is systematic, not an accidental thing, and gender norms are embedded inside policy design, clinical practice, and also professional authorities at all the different levels. And structural barriers directly increase health risk for trans youth. So policy-wise, is there any suggestions that we can give to the government? First one is about the centralized funding model, just mimic Scotland, and this can cut down the waiting time a lot. Second advice is mandatory gender diversity training for clinicians, with some lessons taken by the clinicians, the treatment would be much better to like against those cis-normative assumptions inside healthcare system. And last but not least is use specific access pathway. From the graph, you already know that youth people consist over half of the whole population. Open a special door for them is fair. And that's all for my presentation today. Thank you very much for listening.